A lot of my patients are very busy and they don't have a lot of time to recover from surgery. And Elixir MD really fits in with my sort of protocol for patient care. What I've noticed the Elixir MD do is reduce the swelling. I see less bruising. When I look at the incisions, even 2 or 3 days afterwards, I can see they're already sealed. And that tells me that things are happening faster and better for my patients. The blue light is used to detox the patient, and therefore we use it before the surgery, that morning, and it detoxes, takes away bacteria, and gets the skin and subcutaneous tissue prepped for the surgery. And we've seen that reduces inflammation right there. After the surgery is over, though, the patient goes back to the Elixir MD and gets her first treatment of yellow light. Yellow light is extremely important because it helps cellular repair, and it does so by reducing inflammatory cytokines, and it helps a lot of things. It helps reduce the inflammation, but it also helps lymphatic flow. Subsequent treatments in the days after the surgery include that yellow light, but we also start to include a red light. When we combine that yellow and red light, we call it the NeoXal. What it does is reduce bruising, increase lymphatic flow, increase blood flow, and just as importantly, increase collagen production from fibroblasts. For people that have darker skin, though, we can't do that red and yellow light. It's too stimulating for the melanocytes, and we don't want to create dark scars. So we've combined the blue back with the red to get not only less inflammation and cellular repair, but also to keep the detox going. We combine the red light with the blue light, and that is going to be for the people that have darker skin. But it's going to have the same effect ultimately in terms of rapid healing, reduced swelling, reduced bruising. And therefore, it's a combined effort of all those 3 lights that help the patient heal. And this is important because in this day and age, we don't have a lot of time. We are all busy, and the recovery after an elective surgery should be as quick and as good as possible.